Jassim Al-Kanaji, the head of the organizing committee, to announce the official start of our
أعلن افتتاح مؤتمر موجات فوق الصوتية. المؤتمر الذي أثبت نجاحه نتمنى للجميع التوفيق والنجاح ويعطيكم العافية.
That started in 1975 with the paper on Bright's sheath hematoma, and in the same year increasingly used in the diagnosis of musculoskeletal conditions to evaluate the imaging of the periarticular soft tissue and in stress fractures we are facing in the military field, military training. Typically, ultrasound are used to help diagnose acute tendinopathy, for example, in the ankle, abnormalities of muscles, small benign and malignant soft tissue masses, tumors, and articular changes of rheumatoid arthritis, with a lot of benefits. It is an excellent alternative to MRI for patients who are afraid from closed spaces, and it is of low cost, and if you're going to use it in your office, so no appointment for this. One main advantage of ultrasound examination is the real-time examination. The real-time dynamic examination allows identification of pathology and provides direct correlation between symptoms and observed pathology.
Is to make sure that we speak the same language. And so the next hour, I'll try to more or less give you my take on, or my view on how to, is to look at the sonographic semiology in our specialty. And Uncle in Rome, I even asked her to explain it to me. But there is indeed a definition. It is indeed a more of a philosophy rather than a science. And it's a philosophical type of theory that really depends on signs and symbols. And that's all we are at this moment right now when it comes to imaging. I know you are clinicians and you usually base a lot of your findings on the images. Here's the sort of all semiology is the study of signs. And therefore we want to look at it as a signal in the transducer. On the face of the transducer are some piezoelectric crystals. And this crystals pulse one ping, or two pings, or three pings, and you know, as it keeps sending it, it's going to hit a target, as you can see over here. So now what is the signal, or shall we say the pulse, the signal workshop, that this is the most expensive unit. It's about 3 times the price of the machine, then we call it an echo. So you have one ping or pulse out, and then you get one echo. Now, the same piezoelectric crystals that sent out the signal is going to receive her husband here, Kareem. And so now, once you do that, then again it realigns. Okay, later on, as you go to the intermediate and advanced part, we'll try to show you how we create images with absolutely black. If you remember now, every time you send out a sound, and when you send out a sound and it goes through, let's say, that liver specimen, or today what we're looking at most of the time is what we call rescale imaging. And every time you hit a today, therefore, once we know how to make images, we identify the topographical. One of the best books for ultrasound, aside from Dr. McNally's textbook, is going to be your book in anatomy. Okay? So where you're going to put the transducer. And then if you retain your memory of what anatomy is going to be, for example, first, since I'm a bone radiologist, I like to use the bone linguistic landmark. You notice, for example, some people like to use vascular landmarks, the quadriceps tendon. You see the lines, exactly what Dr. Martinoli showed you yesterday when he said that these are collagen fibers, and then you have the fibroadipose tissues behind this cortex. And you can see the entire extent of the extensor mechanism from the quadriceps musculotendinous union to the insertion of. Once you do that now, very, very important to remember, we begin to appreciate everything that our patients have in their anatomy.
Any is far and away the most common examination that we perform at the Orthopedic Center.
outstripping even foot and shoulder. The main reason for that is because of the infant hip, looking for developmental dysplasia.
Retinaculum that he mentioned. Once you see the fortification, now you can individualize the different compartments. And
you know that this tendon is invested by a tenosynovial sheath. And when you identify fluid, and this fluid is small in amount, as in this case, note that the thickness of this fluid is about 1 millimeter, this finding is normal.